The government is calling today a new day for health care. Starting today, several new rights, benefits, and protections begin under the health care reform bill passed 6 months ago to the day. KXLY4 Sally Showman breaks it down for us. And Sally, what are some of the most obvious changes?
Dave, free preventative care, no more lifetime limits on benefits, and kids can be on their parents' plans now until they're 26 years old, just to name a few. But it's important to point out most people will not notice the changes today. That's because for people with existing health care plans, these changes will not take effect until your plan year starts. For example, here at KXLY, our next open enrollment is not until next July, so I won't notice the changes until almost a year from now.
The dawning of the new day, it's just the start.
Despite that dawn, things inside the group health offices near downtown Spokane were the same today as they were yesterday. Not one patient came in to take advantage of the changes to health care because most people can't. Typically, insurance plans renew at the beginning of the month.
I would anticipate that we'll see the first people that benefit from this October the 1st.
Group Health's regional administrator Bob Burden broke down the changes for us this afternoon.
Right now, it's really just insurance reforms. It's the kinds of things that consumers have been asking for years.
To name a few, insurance companies can no longer put lifetime limits on your benefits or deny coverage to kids under 19 with pre-existing conditions. Also, you will now have the right to demand your insurance company reconsider denying payment for a test or treatment.
Consumer protections built in again so that you've got rights if an insurer denies your claims. There's more protections.
Other benefits include free vaccines and preventative services.
Your annual exams, things like colonoscopies and mammography and those kinds of things, cancer screenings of certain types.
Also, parents can now keep their kids on their insurance plans until they turn 26. That's a personal relief for Burden.
So I wouldn't have to make a decision about my home or my child's medical needs. So that's a big relief for a lot of people.
Now, if you have questions or you want to learn more about these changes, go ahead and talk directly with your insurance company about your specific coverage or broker or agent or your human resources office. Live in the newsroom, Sally Showman tonight, KXLY4 HD News.